Today, we're talking about something that affects us all as we age, the risk of developing dementia. Now, I know this can be a scary topic, but the good news is that there are some surprising and simple things you can do to protect your brain and lower your risk. Though age and genetics are known factors we can't change, recent research has shown that our daily choices and habits can significantly impact brain health. This means that by making certain lifestyle adjustments, we can take control of our cognitive well-being and potentially lower the risk of dementia as we grow older. While you may already know about the benefits of a healthy diet, regular exercise, and keeping your mind active, there are also some lesser-known, yet scientifically supported methods that can further boost brain health. These tips are not only surprising, but also easy to integrate into your everyday routine. So, whether you're focused on your own cognitive health or looking to support a loved one, this video is packed with valuable information just for you. Let's begin. Number 1. Beware of low vitamin D levels. While most people associate vitamin D with bone health, it plays a critical role in brain health as well. Vitamin D, often known as the sunshine vitamin, is produced by the body when exposed to sunlight and plays a vital role in brain function. It helps maintain healthy brain cells, supports communication between neurons, and has anti-inflammatory and neuroprotective properties. Research has shown that low levels of vitamin D have been linked to an increased risk of cognitive decline and dementia. In 2015, UK researchers published a study in Neurology indicating that individuals who were severely vitamin D deficient, levels below 10 nanograms per milliliter, had a 122% higher risk of developing dementia. Even those who were moderately deficient, with levels below 20 nanograms per milliliter, had about 51% increased risk of all-cause dementia. To find out your vitamin D levels, ask your healthcare provider for a 25-hydroxyvitamin D or 25-OHD blood test, which measures the concentration of vitamin D in your blood. Based on your results, your doctor may recommend dietary changes, increased sun exposure, or vitamin D supplements if your levels are low. Regular monitoring, especially if you're at risk of deficiency, can help maintain optimal vitamin D levels and support overall health, including brain function. Number 2. Sleep on your side. While we all know that getting enough sleep is crucial for overall well-being, emerging research suggests that the position we sleep in might actually play a role in reducing the risk of dementia. Specifically, sleeping on our side could be the most beneficial position for our brain. So, why does sleeping on our side matter? Our brain has a natural cleaning system called the glymphatic system, which works primarily while we sleep. Think of it like a nightly janitorial crew that comes in to sweep away toxins and waste products that accumulate during the day. One of the key substances that the glymphatic system helps clear out is beta amyloid, a protein that can build up and form plaques in the brain. These plaques are strongly associated with Alzheimer's disease, the most common form of dementia. A study conducted by researchers at Stony Brook University and published in the Journal of Neuroscience in 2015 found that the glymphatic system is more efficient when we sleep on our side compared to sleeping on our back or stomach. The researchers used MRI scans to observe the flow of cerebrospinal fluid in different sleeping positions and found that side sleeping allowed for a more effective clearance of waste from the brain. Not only does side sleeping help with detoxifying our brain, but it can also improve overall sleep quality. Many people find that sleeping on their side reduces issues like snoring and sleep apnea, which can disrupt sleep and negatively impact the brain over time. Consistent, high-quality sleep is essential for memory consolidation, mood regulation, and cognitive function, all of which play a role in lowering dementia risk. Next at number 3, good oral hygiene. Taking care of your teeth and gums might seem like something your parents nagged you about just to avoid cavities, but it turns out it's also crucial for keeping your brain healthy. Here's why. Your mouth is full of bacteria, some good, some bad. If you don't brush and floss regularly, the bad bacteria can build up and cause gum disease. This is when your gums become inflamed, red, and sometimes even bleed. But the problem doesn't stop there. If left untreated, gum disease can cause chronic inflammation, which isn't just bad news for your mouth. It can also affect your entire body, including your brain. A recent analysis led by researchers from National Institute on Aging suggests that bacteria that cause gum disease are also associated with the development of Alzheimer's disease and other dementias, especially vascular dementia. This is because the inflammation from your gums can spread through your bloodstream, potentially reaching your brain and causing damage there. In fact, some studies, including one published in Science Advances, found traces of P. gingivalis, the bacteria responsible for gum disease, in the brains of Alzheimer's patients. The study suggests that amyloid beta plaques, a major hallmark of Alzheimer's disease, may be produced as a response to this infection. The good news is that keeping your gums healthy is pretty straightforward. Brush your teeth twice a day, floss daily, and see your dentist regularly. It's a simple routine, but it can make a big difference in keeping your brain healthy in the long run. Next at number 4, avoid certain medications. Certain medications, particularly anticholinergics, have been linked to an increased risk of cognitive decline and dementia. Anticholinergics, which are used to treat conditions like allergies, depression, and bladder issues, work by blocking acetylcholine, a neurotransmitter vital for memory and learning. Studies such as one published in JAMA Internal Medicine have shown that long-term use of strong anticholinergic drugs can significantly raise the risk of dementia, with the risk increasing the longer the drugs are used. In addition to anticholinergics, other medications like benzodiazepines, often prescribed for anxiety and sleep disorders, have also been associated with an increased risk of dementia when used long-term. To protect your brain health, it's important to regularly review your medications with your doctor, explore alternatives if necessary, and consider non-drug therapies or lifestyle changes that might offer safer options for managing your health conditions. To learn more about these medications and alternative treatments, you can watch our video on 8 medications that can cause dementia. Next, let's talk about the importance of staying socially engaged. Humans are social creatures by nature, and maintaining strong social connections is not only vital for emotional well-being, but also for brain health. Research has consistently shown that staying socially active can reduce the risk of cognitive decline and dementia. According to a 2023 review published in Nature Aging, UCL researchers found that people who are socially engaged in middle age and later are 30 to 50% less likely to develop dementia later in life. When you engage in conversations, play games, or participate in group activities, your brain is continuously working, which helps to keep it sharp and resilient. It's important to remember that social engagement doesn't have to be limited to face-to-face interactions. In today's digital age, staying connected through phone calls, video chats, and social media can also provide many of the same benefits, especially for those who may have limited mobility or live far from friends and family. Next at number 6, intermittent fasting. You might have heard about intermittent fasting as a popular method for weight loss, but it turns out that it might also have significant benefits for your brain health. So, what exactly is intermittent fasting? Simply put, it's an eating pattern where you cycle between periods of eating and fasting. Instead of focusing on what you eat, it's more about when you eat. The most common methods include the 16/8 method, where you fast for 16 hours and eat during an 8-hour window, and the 5-2 method, where you eat normally for 5 days and restrict calories significantly on the other 2 days. So how does this relate to brain health and dementia? During fasting, the body initiates a process called autophagy, where it clears out damaged cells and proteins, including those in the brain. This process helps prevent the accumulation of harmful protein aggregates, such as amyloid beta plaques, which are associated with Alzheimer's disease. Improved insulin sensitivity and metabolic health associated with fasting may also play a role in reducing Alzheimer's risk. While the early research is promising, it's important to approach any health strategy with caution. Always consult with your healthcare provider before making any significant changes to your diet. And last but not least, treat hearing loss early. Hearing loss, particularly as we age, can lead to significant cognitive challenges. A landmark study by Dr. Frank Lin at Johns Hopkins University found that older adults with hearing loss were significantly more likely to develop dementia compared to those with normal hearing. The study revealed that even mild hearing loss doubled the risk of dementia, and the risk increased as the hearing loss became more severe. The exact reasons for this link aren't entirely clear, but scientists have a few ideas. One theory is that the changes in brain activity caused by hearing loss may lead to a faster rate of brain shrinkage or atrophy, which is often seen in people with dementia. Another theory is that the social isolation caused by hearing loss can reduce the mental stimulation your brain needs to stay healthy, leading to cognitive decline. The good news is that addressing hearing loss early can significantly reduce these risks. Hearing aids and other assistive devices can make a significant difference. One study found that people who used hearing aids had a 50% reduction in cognitive decline compared to those who didn't use them. So if you've been putting off that hearing test or have been hesitant about using hearing aids, now might be the time to take action, not just for your hearing, but for your long-term cognitive health as well. And that brings us to the end of our journey through these 7 surprising ways to lower your dementia risk. I hope you found these tips both enlightening and actionable. Remember, protecting your brain health starts with the small choices you make every day, whether it's how you eat, sleep, or stay connected with others. If you learned something new today, please give this video a thumbs up. It really helps the channel. And if you haven't already, make sure to hit that subscribe button and ring the notification bell so you don't miss any of our future videos on living a healthier, longer life. Thanks for watching, take care of yourself, and I'll see you in the next video.